Hi, I'm Andrea Ferris, the President and CEO of Longevity Foundation, and thank you for joining us today to discuss our new campaign called No One Missed, about the importance of comprehensive biomarker testing and the role that it plays in the lung cancer journey. You know, lung cancer has undergone tremendous transformation in the last 5 or 10 years, and a lot of that has been driven by advancements in science, and with that, advancements in new treatments and better treatment options and therapies. But in order to avail oneself of these treatments, somebody has to understand what's driving their own personal cancer. What is it that makes their lung cancer special and unique, so that then they have the information, and the doctors also have the information to understand how to better treat them. In order to get that understanding, it's really important to have comprehensive biomarker testing. This is a test that can be done, and we'll learn more about it in today's Facebook conversation about what it is, how it works, and how it can help doctors like Dr. Gomez and Dr. O make better treatment decisions so that people like Tabitha can benefit from that. So this is why we created the No One Missed campaign. The campaign, the goal of it is exactly what it says, what the name says. It's to ensure that no one diagnosed with non-small cell lung cancer is missed when it comes to comprehensive biomarker testing. It should not matter where you live, what you look like, what language you speak, as to whether you should be able to get access to the best medical care and treatments that are available to you. And that includes comprehensive biomarker testing. Before we get started, I'd like to give a special thanks to our founding partner, AstraZeneca, founding members Amgen and Genentech, and supporting member Pfizer for their ongoing support of No One Missed campaign, along with a lot of other sponsors and supporters as well. We wouldn't be able to do this and to bring this important message to people without your help. I'd now like to introduce our panelist, Dr. Ray Osara-Giagbon from Baptist Cancer Center in Memphis, Tennessee, Dr. Jorge Gomez at Mount Sinai in New York City, and Tabitha Pacione and her husband Tony. Tabitha was diagnosed with lung cancer in 2016 and has been living with ALK-positive non-small cell lung cancer ever since. Thank you for being here and joining us in this important conversation. I'd also like to introduce Katie Miller, AstraZeneca's U.S. franchise head for lung cancer, who would like to say a few words about AstraZeneca's support for the No One Missed campaign and the importance of comprehensive biomarker testing.
Hi, I'm Katie Miller, head of the Tagrisso franchise in the United States for AstraZeneca, and I'm very proud to be a founding partner of the No One Missed campaign in collaboration with Longevity Foundation. We are tremendously encouraged to see lung cancer survival rates on the rise in the United States. However, despite recent advancements in targeted therapies and in precision medicine, lung cancer continues to be the leading cause of cancer death in the U.S., more than breast, prostate, and colorectal cancers combined. Lung cancer is recognized by many as one singular disease, but in reality is a collection of many different unique types of tumors that start in the lungs, making it very complex. Unfortunately, some patients with the most common type of lung cancer, non-small cell lung cancer, are not receiving a fully informed diagnosis about their specific tumor type due to a lack of biomarker testing to determine the particular presence of their particular mutations. Despite broad agreement on the importance of comprehensive biomarker testing for people living with non-small cell lung cancer, there is still variable uptake in clinical practice. Even the most common targetable mutation, EGFR, for which testing has been part of standard practice since 2011, is not always assessed. In fact, recent data show that less than 1 in 4 of eligible patients with advanced non-small cell lung cancer were tested for all of the biomarkers associated with US FDA-approved targeted therapies at the time that the research was conducted. People living with lung cancer who have not received biomarker testing may not only lack a full understanding of their individual disease, they may also be missing out on information regarding treatment options that target their individual type of cancer. At AstraZeneca, we envision a future where there's no one missed when it comes to biomarker testing in non-small cell lung cancer. That's why we're thrilled to work closely with the Longevity Foundation as they lead an esteemed group of partners on the No One Missed campaign with the critical mission to increase biomarker testing rates for people living with non-small cell lung cancer. It's not every day that you see representatives from such an array of organizations and companies come together with a common interest. However, through this campaign, Longevity has offered a unique opportunity for the lung cancer community to join forces. This collaborative approach allows each partner to combine resources, connections, and expertise in pursuit of our shared goal: to educate people with non-small cell lung cancer on the importance of comprehensive biomarker testing. We're determined to improve awareness around the critical nature of biomarker testing for patients, for the oncology care teams that treat them, and for the policymakers who determine their access to the tests. We're very grateful for Longevity's leadership on this initiative and look forward to seeing what we can accomplish together. It is our hope that continued education about comprehensive biomarker testing will allow more people living with non-small cell lung cancer the opportunity to receive appropriate treatment options for their unique tumor types. At AstraZeneca, we aim to lead a revolution in oncology to redefine cancer care. We seek to understand cancer and its complexities, and then focus where it matters by treating disease earlier and unleashing new treatments for precise targets to help ensure patients receive the right medicine at the right time. Our pursuit is relentless. We start with one biomarker, one clinical trial, and build from there until success is achieved. This approach includes thinking differently about the underlying biology of lung cancer, from the early stages where we aim to help people live longer with a goal of cure, to late stages where we look to meaningfully extend survival. Our focus comes down to a drive to deliver precise medicine that makes an impact on patients, ultimately transforming their lives along with their families and their caregivers. No One Missed will help us to reshape perceptions around biomarker testing and lung cancer treatment and reach one patient, one biomarker test at a time to create lasting change. We are so proud to stand alongside Longevity as they lead the lung cancer community in this work. We're excited today to sponsor an expert panel to offer perspective on why biomarker testing is so imperative for the continued improvement in treatment of non-small cell lung cancer. This panel will answer some questions posed by people living with lung cancer and their loved ones from across the country. We're thrilled to join our distinguished partners in pursuit of this campaign's mission, and I'm excited to see what we can accomplish together. I would like to extend a heartfelt thank you to Longevity for their leadership in putting together this vital conversation. Thank you so much and enjoy the discussion.
Thank you, Katie. Really appreciate your remarks as well as your support. Thank you again for all being here. I look forward to today's conversation. Today we're going to talk in three really broad categories. The first one is to understand a little bit more about what comprehensive biomarker testing is. Then afterwards, we'll hear from Tabitha and Tony about the impact that biomarker testing has had on them and their own experience with lung cancer. And lastly, and most importantly, there will be practical advice for patients and their caregivers on how to access comprehensive biomarker testing and the important way to use it in their own lung cancer journey. So with that, let's get started. So with this first segment, I'd like to talk to Dr. O and Dr. Gomez about biomarker testing. Dr. Gomez, can you talk a little bit about what biomarker testing is, and specifically comprehensive biomarker testing?
Comprehensive biomarker testing is when we take a small amount of tumor, hopefully from a biopsy, and try to figure out if there are genetic abnormalities in that tumor that can be measured and that can be used for treatment. So there are many different abnormalities or biomarkers that we can find in patients with non-small cell lung cancer. We can find mutations or changes or damage in the DNA of the tumor. We can find molecules on the surface of lung cancer cells, and these can help us in terms of guiding the treatment for lung cancer.
That's great. Thank you so much. And what does it mean for a biomarker to be actionable? A lot of lung cancer patients, when they hear these terms or they hear about new treatments, it's about actionable biomarkers. What exactly does that mean?
When we do comprehensive biomarker testing, we often find a lot of biomarkers. Some of them we can actually address. So we have drugs for multiple different biomarkers, and the actionable ones are the ones we have drugs for, the ones that we can actually change. But there are a lot of other biomarkers for which we don't yet have drugs. You know, we've looked at different biomarkers, for example, KRAS in non-small cell lung cancer, which for a very long time was a non-druggable target. And now there are drugs in research that have been able to target KRAS. So that would make it finally actionable.
So actionable for a patient, another way to think about it is it gives information for which their doctor can take an action, or there is an action to be
Correct.
taken for them. Is that another way to think about it?
Correct.
Excellent, thank you. And Ray, or Dr. O, whichever way we'll go with it, we'll go
Call
with
me
Ray.
Ray. Ray
Excellent.
works better, I think.
Excellent. Well, thank you for that. But could you explain to the audience also what comprehensive means? We've been using that term a lot lately, and they might not understand the difference between comprehensive biomarker testing or single gene biomarker testing, but what is it and why is it important?
Yes, thank you, Andrea, and thank you for giving us the opportunity to share with your audience today. So the wonderful thing about where we are today is that our knowledge about what drives a cell to behave like a cancer is rapidly expanding. And that rapid expansion has created a situation where just about every few months, there's a new discovery, either of a potential biomarker or of a drug that really works against it. So whereas 10, 15 years ago, when we really started getting into the space with lung cancer, there was a small handful of biomarkers that we could do something with. The expansion is the pace of discovery, the expansion is so rapid that single gene tests are no longer efficient, not really tenable anymore. The other aspect of this is that, unlike in the past where we said, well, there are really two types of lung cancer, small cell lung cancer and non-small cell lung cancer, we are now in an age where what we used to call non-small cell lung cancer is no longer a monolith. It's now fragmented into smaller and smaller bits of cancers that are really characterized by specific biomarkers. Therefore, if we decided to guess and figure out which test to do first, single file like that, we would delay immensely the care that people would receive, and we would exponentially increase the danger that we fail to identify in any individual patient the biomarkers that could have rescued them from a bad situation. So when we talk about comprehensive biomarkers, it's a little bit of a paradigm shift. We're saying right up front, when you diagnose the lung cancer and identify the need for a biomarker test, please do the panel of tests that at a minimum are currently actionable. What Dr. Gomez just told us about the tests for which you have treatment that can actually be applied to the individual patient.
And I think that's the important part, especially for patients to understand, is that it can be done at the same time. It's to test for all of these things at once so that then when you get the results, you can make a fully informed decision with your doctor and healthcare provider. And I think that that's a very important point. But Dr. Gomez, are there any limitations or reasons why somebody diagnosed with non-small cell lung cancer would not get comprehensive biomarker testing?
So there are some limitations. There are, for example, segments of the non-small cell lung cancer population that typically do not have actionable biomarkers, like, for example, patients with squamous carcinoma. Now, some patients with squamous carcinoma do have biomarkers that are actionable, but the majority do not. And so we try to test the patients where we're more likely to find a genetic alteration or a biomarker. Other limitations, unfortunately, these tests require a specific amount of tissue. And in an era where we're getting smaller and smaller biopsies for patient comfort and patient satisfaction, we sometimes run into the problem of not being able to do the testing because there isn't enough tissue in the biopsy. One other limitation is how long it takes. So these tests are complex, and they can take anywhere from 7 to 10 days in very fast laboratories to 2 to 3 weeks in slower laboratories.
So just to clarify a couple points with that, though, from what I understand you were saying, people with adenocarcinoma, which is a type of non-small cell lung cancer, in general, everybody should have comprehensive biomarker testing.
Correct.
There might
All
be
patients with
situations.
non-squamous.
Yes, there might be situations if there's not enough tissue available, for example, or if for whatever reason your doctor feels that they need to act quickly or quicker than waiting for the test results, which shouldn't often be the case, but sometimes may be the case, where they might have to take action before you could get the testing done. But there are also, in some circumstances, alternatives where perhaps if there's not enough tissue, you could use a blood test to help give you the information. It won't give you the same amount of information as the tissue biopsy, but there are certain circumstances where a blood test could help. Is that a fair characterization for our audience?
That's correct. And I generally try not to start treatment until I have all of the comprehensive sequencing done. There are as you mentioned, few instances where we find ourselves forced to start some form of therapy, generally chemotherapy, because the patient is very ill and we need to start treatment immediately. But in the vast majority of cases, we are able to wait for those results. If we can't wait for the results, we generally try to treat with only chemotherapy and then address any results that come after.
From your perspective, why is it so important to wait to make treatment decisions based on the results of these tests?
In the clinical trials that have been done, there have been benefits to using targeted therapies in patients with mutations or changes in their DNA. Although we haven't proven that patients live significantly longer, we have proven that it takes longer for their tumors to grow and that the side effects of treatments might be significantly better.
So Ray, what are some of the steps that people can take to ensure that they get comprehensive biomarker testing? I would hope that it becomes more normal, but we know that not everybody, even today, get this testing done. So if your doctor hasn't recommended it or offered it to you, what are some steps that people can do to get the comprehensive biomarker testing?
Yes, Andrea, this is a hugely important point. And the reason for that is, first of all, biomarker testing and the actions that might follow that are profoundly impactful on patients. We know that. It's also important to remind everyone that a lot of these drugs that we use in response to a gene mutation for lung cancer are much more conveniently taken because most of them are pills. So the difference between being able to stay home and take a pill every day and maybe see your doctor every 3 months if things are going well, and having to come into an infusion center for IV chemotherapy just about every 3 weeks, it's a night and day difference. So along the same time, we must confess as healthcare providers and organizations that we have not flipped over overnight and suddenly started using these drugs for everybody. There's a big gap between what is and what ought to be. And patients need to be empowered to recognize that that gap exists. It's not that your doctor is hiding stuff from you or is trying to hurt you in any way. It's just maybe the doctor doesn't know, or maybe the doctor has not prioritized it just as well. So the first thing I would say is our patients need to be armed with knowledge. They need to be empowered to ask questions of their doctors. The doctor is not a god. He's a human just like you. And he has human failings, part of which may just be he didn't know. So I think it's important for us to talk about this, ask about it. I have lung cancer. Wow. What's the best treatment? How do you know what is the best treatment? Am I a candidate for a biomarker test? What is this biomarker? How are you going to be able to tell what my best treatment option is? Is there a pill that you could treat me with? I hear there are all these wonderful pills out there. Am I a candidate for one of those? The point being, the only way the doctor will know what the best treatment for you is as an individual patient is if he does the biomarker test. The reason is, think of your cancer as a lock, as a locked door, and the targeted treatments as the specific key that will open the door. But you can't just grab any old key and expect to open every door you run into. You have to make sure that the key matches the lock and will open the door. That's the role of biomarker testing. And that's why you have to challenge your doctor to make sure that he does your biomarker test as early as possible into your care.
That's a fantastic visual. Thank you for that. Dr. Gomez, Ray just alluded to it in terms of sometimes your clinician, he or she may not know. And it's not that they're trying, and I think a lot of that is because of the pace of the advancements. There have been so many exciting advancements and just the acceleration of the understanding of the biology and what's driving lung cancer, even in the past 5 years. So, has biomarker testing been around for a while? Is this a new concept, or is it really the comprehensiveness of it, which is the new part that needs to be put out there, that people have to understand that it's not just 1 or 2 things that we understand anymore, it's 9 or 10 or 12. And as we just discussed, new discoveries are happening every day.
The biomarker testing, as we envision it, is really more of a new phenomenon. For lung cancer, biomarker testing started in about 2003 when the first EGFR mutation was discovered. And since then, we've discovered so many, and with so many different drugs. There are 5 or 6 drugs for this mutation, 5 or 6 drugs for another mutation. And so it's not just the daily barrage of new potential biomarkers, but new drugs for each of those biomarkers. The more comprehensive testing is much more recent. And so from the more recent FDA approvals of not only tissue biomarker testing, but blood biomarker testing has really been in the last decade.
Yeah, it's exciting. It's very exciting, all the advancements that everybody's making. And Ray, what would you say to someone if their first test came back and right now it doesn't have an actionable biomarker? What would you tell them to do?
Oh, yes. I would tell them, go on and explore the next step. So there are other next steps, of course. One very important one, we have talked about biomarkers as if it's only genetic testing. It's important to understand that there are also protein biomarkers. For example, one big biomarker that we must never forget is the biomarker that predicts how likely one is to respond to immunotherapy. So there's something called PD-L1. So the proportion of the tumor that expresses that protein can be scored. And if the percentage is high enough, such as 50% or greater, patients who have that may have the option of taking immunotherapy by itself without chemotherapy, especially if there is some reason why chemotherapy may be tough for them. It certainly gives you a conversation piece to have with your doctor. It's information that is, in the right setting, useful. However, one can go ahead and be treated without that specific biomarker information, because there is also pretty good evidence that for patients who are willing and able, taking the combination of that type of immunotherapy along with chemotherapy, so-called chemoimmunotherapy combinations, actually are significantly superior to taking chemotherapy by itself. So if we didn't have a targetable gene mutation for which a pill is available, typically the doctor and patient would quickly want to move on to chemotherapy combined with immunotherapy, or in certain situations, in the right setting, immunotherapy given by itself. Now, there are also increasingly less common scenarios under which one might consider doing chemotherapy without the immunotherapy part. But that is becoming more and more of a rarity in lung cancer care.
Yeah, that's exciting. And the other thing too, I'd love to get your thoughts on, is because of the pace of the advancements, is to have the comprehensive biomarker testing done, even if there might not be something right now that's available to you as a patient, there could be something in a year's time. There could be something in a clinical trial. And so to not forego the comprehensive biomarker testing because we don't know what's coming, and there's a lot coming.
Yeah, Andrea, that's a perfect point. We're in the middle of that right now with the KRAS G12C mutation. So all those people we did comprehensive biomarker testing for years ago who didn't have something, all they had was the KRAS gene mutation, this particular subset, G12C. We basically had to treat with chemotherapy and immunotherapy. So absolutely, great point. Rapid pace of discovery. This information, not actionable today, will become actionable tomorrow.
Yes. Dr. Gomez, do you have any final thoughts with respect to that?
No, I agree. There have been many instances, many mutations which we've kind of kept in our back pocket, and then a treatment has surfaced. Another example would be HER2 mutations, which initially we were not able to target well, and which now we're able to target significantly better with multiple new drugs.
That's very exciting. I never thought that I'd say that when I got started in this, 10 plus years ago, that it would be such an exciting time with so many new advancements for patients. And it's all started with the comprehensive biomarker testing. So thank you. And thank you for providing such great information in this part of the conversation. With that, I'd like to move on to Tabitha and Tony. Thank you for being here and sharing your own personal journey with us. Tabitha, you look fantastic. Incredible inspiration. As I said when I introduced you, you've been living with, non-small cell ALK-positive lung cancer since 2016, which is phenomenal. So thank you. Can you talk to us a little bit about when you were first diagnosed, how you found out, how it made you feel? I mean, that's sort of a bit of a silly question, I guess, in terms of how it made you feel, but just sort of what your own experience with your lung cancer diagnosis was.
Yeah, absolutely. Thank you so much, Andrea, for having me be a part of this. This is comprehensive biomarker testing is so close to my heart and such an important thing that I advocate for. And I think going back to my diagnosis, probably the most effective word that I can come up with is blindsided. That's exactly how I felt. As a 35-year-old active mom of two, I ate healthy, I exercised, I thought I was doing everything right. And, on top of that, being a never smoker and not having cancer in any side of my family, being told that I had lung cancer was completely blindsiding. And I just remember the day that I was sitting in the doctor's office, and I apologize if I get emotional because it's still, even 4 years later, it's still very fresh. But I remember sitting in the doctor's office and hearing those words, and probably the only thing that I remember was kind of a snapshot of all of these experiences and memories. My son graduating from college, my daughter walking down the aisle, shopping for her prom dress, all the things that I wouldn't be here to experience, because what I knew about lung cancer was that it was a death sentence and that I was not going to be here to experience all these amazing things with my family.
So what changed? I mean, and that is not an uncommon sort of experience, and I think first thoughts that people have when they hear lung cancer and when they hear that diagnosis, because they don't know about all of the advancements that have been happening, and as well as the new treatments. And let alone meeting people like yourself, and so I think that's why it's so important that you're here and you're talking about it, to let people know that it can happen to anybody. And so thank you for sharing that information. When you were diagnosed, when and where were you given comprehensive biomarker testing, and how did that fit into your treatments?
Sure. So in my experience, my oncologist and my care team, they're just very well versed in lung cancer. So I was offered comprehensive biomarker testing immediately, a tissue biopsy as well as a blood biopsy. And that really kind of put me, on the fast track to being able to be part of targeted therapy. And kind of mirroring what Dr. O said, I had no idea that targeted therapy or a pill was even an option. I thought that the only option that I had was chemotherapy and or radiation. And so being able to, go from not really having any understanding about comprehensive biomarker testing to having an oncologist that really not only pushed for it immediately, but explained it to me, completely in a way that I really understood, was probably where, my journey really just kind of moved into that area where I was able to have that quality of life and, not have to go through those days where I would have to go into infusion, because I was, as part of my initial treatment while the testing was, being sent away, I did have one round of chemotherapy. So to know that there was this pill that I could take was just so encouraging.
That's great. And Tony, you obviously are a phenomenal care person, being there with Tabitha throughout this entire journey. But how did the diagnosis impact you, and how have you helped her with the treatments and the comprehensive diagnosis? Was it explained to you? And how important is it also that the care person understands all of the different options and what's going on?
Yes, thank you for having us. Kind of learning very quickly, you want to research, and our doctor was like, don't do any research, but it was more about the results and what could happen. But we learned that we definitely need to be advocates for ourselves. And so definitely want to research, and like Dr. O was saying, ask those questions and know what to look for. And as taking care of her, I realized that I need to not put myself in her position. So it was never, I know what you're feeling or I know what you're going through, because I have no idea. And so trying to support her and make sure I support the children. And as far as going to doctor's offices, you want to have those conversations and you want to ask those questions. But I learned very quickly it was important to know that this was Tabitha's journey and her results were going to be hers, and how things worked were going to be her path. And so looking at biomarker testing and how there could be mutations for people, it didn't necessarily mean there would be for Tabitha. And if there were a pill that she could take, you're learning very quickly that this pill might work for X amount of months with this person, and doesn't necessarily mean that it's going to work that long for Tabitha. And so asking questions, writing things down, because the doctors are speaking almost in a foreign language and they're using a lot of words and things, and you're just writing things down. And the doctor was very patient and let us know if you have any questions, follow up. And so just write things down and then go home and research them and look them up and then have those questions. And so for me, in the position that I'm in, it was about trying to not only emotionally be there for her, but also pay attention and ask those questions.
So Tony, question for you, and I know that as you said, it's Tabitha's journey and the disease is affecting her, but to all of the other care people out there, it really does impact the whole family. And it's your journey too. You might not be dealing with the disease yourself, like as part of your body, but you are also having to deal with the disease and understand it and things, and navigate that to support her, but also yourself and your family. So what advice would you give to a caregiver or a care person with someone who is dying, with their person who is newly diagnosed with lung cancer? What advice would you give to them, or what would you say to them?
I would say be patient. Definitely carry a notebook and a pencil, and I think just be prepared to have honest conversations. They're going through a lot, and so definitely listen and decide what your action plan is going to be. So we'd asked early on what we were going to tell our kids, and our care team said, well, she's probably going to lose all of her hair very quickly, and so you have to decide if you want your kids to come home from school and their mom be bald, or do you want them to come home from school and kind of know what's happening. And so we sat them down and decided that we would tell them and make sure that we used soft words, because cancer is such a big word, and generally when you think cancer, what you see on the TVs or movies and like tablets, that it's a death sentence, and it's not necessarily something that we all think about, or unless we're involved in it like you three on a daily basis, if it's all of a sudden just forced into your world. So you need to have the conversations, but be patient and be understanding and really just support her. So if she wants to binge on cake at 2 a.m, you can eat cake with her. And Jack, I'm supporting you. I'm doing this for you as you polish off a cake or a whole pizza. And so she's gonna have those moments, and I think you very quickly realize that things like maybe the dishes not being done or a bill not getting paid is really the least of your concerns now, and you're in a different headspace as far as just let her kind of go through it. And she might have her bad days, and she's gonna have her good days, and you need to be there for her and find an outlet for you. And so I struggled with, I didn't want to talk to her how I was feeling, because in my mind I'm like, you have enough on your plate. I don't need to burden you with how I'm feeling and make you feel like you have to take care of me. But she and I have been married long enough that she knew when I was struggling, and she would ask me if you're okay, or she'd give me my space. But I think you just have to be honest and open and be able to communicate with each other, because like you said, I mean, I guess we're both battling this and we're both going through this, and so we need to attack it together and not attack each other.
I also think that, caregivers don't get enough credit. He has a very difficult job. Not only is he taking care of everything in our house, dealing with the children, my treatment, but he's also, trying to deal with his emotions. And so I think my advice for a caregiver would be, find that support group, find that connection, because that's really important in a journey. And I think being able to talk and share feelings and, speak with people that really understand what you're going through is important, not only for a survivor, but also a caregiver.
No, I think that's tremendously important information. Thank you both for sharing that with us. So Tabitha, what is it that you would want somebody newly diagnosed with lung cancer to know, both about the disease, and I think that your advice with respect to finding that support network, but also with respect to the importance that comprehensive biomarker testing has played in your journey?
So the number one thing that I tell people, that I speak with now that are newly diagnosed is there is so much hope. Lung cancer is not what it used to be. There are so many advances now as far as treatment and biomarker testing, but there's so much more in the pipeline. And thank you so much, Dr. O, for saying that about how, there's discoveries like every, few months, because that really gives me hope. And I try to tell patients that lung cancer, we are very, very close to making sure that no one dies of lung cancer ever again. And that is really, really important because of how I felt when I was diagnosed. So I really try to emphasize that when I speak to newly diagnosed people, because they're, we're scared and we're frustrated and it's overwhelming. But to hear that there are these treatments, there are these pills, there's immune therapy that can really, really change the course of your lung cancer journey is so encouraging. Number two is I always emphasize how important comprehensive biomarker testing is. That's usually one of the first questions that I ask a newly diagnosed patient is, have you had comprehensive biomarker testing? And what do you know about it? And, most often, I would say even almost like 100% of the time, they don't have any idea. And so my next recommendation to them is, go back to your doctor. Like, when is your next appointment? And during that next appointment, bring it up, ask the questions. Because number one, you have to fight for yourself. It's your life, like you are fighting for your life. So any question that you want to ask your care team or your oncologist is perfectly fine. And number two, if you have a doctor that doesn't want to answer the question or doesn't want to provide you with comprehensive biomarker testing, then they're not the doctor for you. And you need to find someone that's willing to go that extra mile and to fight for you, because that is your right. So.
That is excellent. And that is actually the perfect segue into our final segment, which is practical advice. And I think that was the number one thing that anybody could listen to. And Dr. Gomez, Ray, I saw you giving the thumbs up on that one in terms of, that it's okay for a patient to ask, and a patient should ask. And what are your thoughts with respect to that as clinicians when your patients come to you with questions? And what do you say to patients whose doctors are not receptive to questions?
I think it's very, very important to ask all of those questions. And I agree that if the doctor is not open to answering questions and not open to doing testing or getting recommendations from a patient in terms of which direction to head, I think that it's important to find a new doctor. There are oncologists everywhere, and the majority of oncologists in the country are very good. And most of them, because of what they've been doing, because of the diseases they treat, are open to questions and are open to discussions and being partners with the patient. But there are some doctors who just don't. And so it is critical to ask those questions.
Yeah, and along those lines as well, Tabitha, you referred to it as learning a whole new language. Maybe Tony, you referred to that as well when you were newly diagnosed. So Dr. Gomez and Ray, how do we help doctors to speak more? Your lock and key example, Ray, at the beginning, that was so perfect and illustrated what it is about a very complex scientific, issue to a person newly diagnosed. But how do we help patients have better conversations, and also doctors have better conversations with their patients to help them to understand and explain this really vitally important but yet complex issue around comprehensive biomarker testing and how it can help inform better treatments? So Ray, how would you help to explain that better?
Sure, Andrea. First thing I would say is I would like to nominate Tony for Man of the Year. I mean, that discussion
Yes.
about the depth of his empathy for Tabitha, his service mentality, the understanding that it's not about him, it's everything about Tabitha. It's exactly the same approach that the doctors have to take. When we talk about patient-centered care, when a doctor is in a room with a patient across from him, at that given point in time, in most cases, it is the patient who has a life-threatening problem. And the doctor is there as a servant. Just the way Tony expressed his service is the way the doctor needs to be able to do. So with that, we understand that we have to speak in terms that allow people to gain understanding from doctor on to patient and caregiver, okay? We have to be willing to let them ask questions, understanding that at that point, the moment you say lung and you follow it with cancer, people stop listening. So you can't start shoveling barrelfuls of information at people under that circumstance. We have to understand that and create other means of communicating, not just doctor to patient. We have to have materials that we share with patients to help them go home and read and understand. We have to be willing to let people record our conversations. I know a lot of patients do it surreptitiously. I just tell them there is no need to hide. This is complex. This is hard. It's coming at you thick and fast at a time when you're least prepared for it. Goodness, record it. It's okay. And if you ask me a question that I can't answer, I will confess I don't have that knowledge. And if there's somebody who has it and I know of that person, I will reach out to them. And if you know of somebody, by all means, feel free to get a second opinion. It's not about the doctor. So communication is really helping people understand what we understand from our end. So we're all on the same page, we're reading off the same script, and we can act the same play together with mutual understanding.
No, that's very helpful. So Ray, this is a question for you and Dr. Gomez. You know, we've heard a lot about the role that comprehensive biomarker testing plays in a person's lung cancer journey. And part of the No One Missed campaign and why it's so important, I think, is to get the information out there is not just for patients, but for providers also, healthcare providers and doctors, to understand how important it is. Because despite all of the advancements, we know that many people in many parts of the country are still not being tested. And they're not only not being tested, they're certainly not being tested in a comprehensive way when diagnosed with non-small cell lung cancer. And so my question for you, Ray and Dr. Gomez, is why? Why do you think that is? And what can we do to change that situation to make sure that everybody has access to optimal care?
Yeah, I think the answer to the question, why don't we routinely test, is at several levels. So at the doctor level might be just the problem the doctor has so many different types of cancers he deals with. He doesn't really know how these rapid fire changes are coming for lung cancer patients. So the doctor's limited knowledge can be an obstacle. The other is that these comprehensive genomic testing, biomarker testing are often not done in-house within the hospital. They have to be ordered and the material has to be sent to specific companies. And if the healthcare system or the provider and his clinic don't have a standardized process for activating the testing, then you're left with a haphazard way and chances are people will get missed.
No, I think that's hugely important. As you know, at Longevity, we do advocate for all people diagnosed with lung cancer to have access to optimal care. It shouldn't matter where you live or what you look like or what language you speak, have that decide whether you get the best medical treatment available or not. But with respect to that, Dr. Gomez, you know, Dr. O brought up a really interesting point in terms of oftentimes clinicians or doctors don't order the test. From your perspective now, given what we know about lung cancer treatments and given what we know about the significant advancements and benefits that they can offer, what would you say from it sounds like it should just become part of the standard medical practice to order these comprehensive biomarker tests.
I think that's very true. I think it actually is bad medical practice not to have it. And one of the issues is, again, that it's not done in-house. And it's not, you know, the pathologists, for example, at certain institutions aren't specialized in just lung cancer. They do everything. At some institutions, we have lung cancer pathologists who will order the testing for every single patient or every single sample that comes through with non-small cell lung cancer or non-squamous non-small cell lung cancer. I also see, while there is some testing in some cases, that it's not comprehensive. And so I see patients for second opinions who come in with 2 or 3 biomarkers tested. So they have EGFR, ALK, and ROS1, and those are negative, and so they're started on another treatment, potentially on chemotherapy and immunotherapy, without more comprehensive testing. Because, sometimes the news that there are new biomarkers and new drugs for these biomarkers doesn't travel that fast, or some people don't have as much access to literature, and perhaps it takes them a little longer to realize that there's a new drug and there's a new cancer that can be treated. But I do agree that this needs to become completely standard, although it may be somewhat difficult, because I think that even until very recently, we saw breast cancer biopsies come through without ER/PR testing, without the most basic biomarker testing for breast cancer. And so it's more complex to do it in lung cancer, but it should be done. There should be a big effort to do that.
It definitely takes a village. So sometimes the whole city to
It takes the whole world.
help move this along. The science is moving so fast and the discoveries are moving so fast, which is hugely exciting for patients. Now we just need to get the rest of the system caught up to that to make sure that all people can access them and benefit from these new advancements. And along those lines, Dr. Gomez, what would you say would be the 3 to 5 key questions that a newly diagnosed patient could ask their doctor about their lung cancer or about comprehensive biomarker testing?
So just starting with the disease, I think there's a list of questions just about lung cancer, and then there's a list of questions about biomarker testing. In terms of the lung cancer, the first question really that always comes to mind is what is the stage, because the stage will drive the treatment. Now, stage in the past had not been relevant in terms of biomarker testing because we didn't use targeted therapies, which were the only biomarkers we used in patients with earlier stage disease, but that has changed. And so stage is still important in terms of biomarker testing. The next question is always really what's the best treatment, and that requires the question of biomarker testing. So have I had biomarker testing done on my tumor? Because you've already been diagnosed with lung cancer, which means that you've probably had a biopsy. It's been a week or it's been 2 weeks. And so sometimes when I see a patient for the first time, I already have comprehensive genomic testing or biomarker testing done, and I have it in my hand, and I can tell the patient exactly what he or she has. But in many cases, it hasn't been completed, or it hasn't been ordered. And so that's the next question. Has comprehensive biomarker testing been done? And if it hasn't been done, is there enough tissue to get it done? And how quickly can we get this rolling? Can we move along? The next question is really going to be, what is the best treatment for me? And again, that answer isn't always available on visit 1 because you don't have all the information you need. But that should prompt a conversation of what are all of the different options for lung cancer, depending on the results of the biomarker testing.
No, I think those are very, very good questions, and it seems to reflect a lot of what you have said, Tabitha and Tony, in terms of your own journey, and Ray, also in your approach to treating lung cancer patients as well. So with that, are there any final thoughts that you'd like to share with a newly diagnosed person or someone who has been diagnosed but perhaps hasn't had comprehensive biomarker testing done? I don't think it has to be done only at initial diagnosis. We at Longevity advocate for asking at least about comprehensive biomarker testing before any new treatment decision is being made, and to see if that can help inform that new treatment decision. But wondering if you had any sort of parting thoughts for our audience today. I'll start, Tabitha and Tony, with you.
I mean, I think I would just, reiterate how important it is to advocate for yourself, to feel empowered, and to know that it's okay. And I love that Dr. O suggests a second opinion, because that just tells me that not only is, my care team and my oncologist brilliant, but they're also humble, and my oncologist did that. And that's how I knew that he was the right doctor for me, that he told me to go and get a second opinion if I wanted it. And so I knew from that day on, any questions that I would come to him with, he would be willing to slow down and answer and never make me feel like I wasn't the most important person. I'm not just another case or a file. I'm someone, he's not fighting for me. Your doctor isn't fighting for you. They're also fighting for your husband and your parents and your children. And so I think you need to remember, and I think that we just need to continue to, encourage comprehensive biomarker testing, just because I think, the misconception sometimes is that it's small rural towns and small hospitals that don't necessarily offer it because they don't really have access to it. But in my experience, it's in bigger hospitals in cities where we live. And I think that the way to get that out there is not only campaigns like this with longevity, but it's also us as patients asking for it. And the more we can get this out there, it doesn't have to be an initial diagnosis. Ask for it now.
I think that's great advice. Dr. Gomez, what would you say as final thoughts or parting words for people?
In my eyes, what's very important when someone is diagnosed with lung cancer is to really be able to communicate with their doctor. So after you hear what the doctor has to say about what you have and what the treatments are available and what's possible and what's not possible, then take a look at your expectations from the treatment and voice those. Tell your doctor, this is what I want from this treatment. Can you help me get there? And the doctor will, hopefully be very honest and say, yes, I will do my best, et cetera. But it's really important to communicate that, because doctors can't guess. And they're not stones either. Doctors in general care, and they want to know what people are thinking and what their concerns are.
No, I think those are great words of advice as well. And Ray, how about for you?
Well, I will part by emphasizing that in a world of rapid fire discovery, the best treatment is a clinical trial. There is need for us to raise awareness of that. One of the greatest scandals in adult oncology in America, in my mind, is the reality that only 4 to 8% of adult oncology patients wind up in clinical trials. Compare that to pediatric oncology, where 60 to 80% of children diagnosed with a cancer get on a clinical trial. That is the exact reason why pediatric oncology has outstripped adult oncology in the effectiveness of their treatments, to the point where the main emphasis in a lot of pediatric cancers is not really helping children survive. It's actually minimizing the long-term side effects of treatment. They have the luxury of being able to do that work now because they have done the heavy lifting decades ago in getting treatments to be effective. That's what we need in adult oncology. And the way we're going to be able to get this rapidly expanding knowledge about cancer biology into meaningful impact on the lives of people like Tabitha and Tony is going to be getting more and more of our patients into the clinical trials that teach us how to do better.
No, that's great advice. And to get onto the clinical trials, oftentimes you need to have that comprehensive biomarker testing done to know what you're eligible for.
Exactly.
So I think that's really good advice. So with that, I'd like to thank all of you for being part of today's discussion on the No One Missed campaign and the importance of comprehensive biomarker testing. Dr. Gomez, Dr. Asaragiagbang, and Tabitha and Tony Paccione, thank you so much for joining us today and sharing your insights with us.
Thank you.
Thank you.
Pleasure. Thank you, Andrea. And thank you, Tony. Thank you, Tabitha. You guys are wonderful. What a heartwarming couple. What a story.
Yeah, that was fantastic. Thank you guys.
Thank you.
Thank you so
And we
much.
need more patients who are able to communicate their journey and want to do it. I've often asked some of my patients if they would like to share their journey through media, and some of them are somewhat reluctant. And I understand it's a difficult process, but it's so good when somebody decides, I want to share.
It is, and it gives such inspiration to so many other people who are newly diagnosed or who are living with the disease as well. You guys are fantastic, so thank you.
No, thank you. I think it's so important. I do it mainly because I remember when I was first diagnosed, I didn't have anyone to kind of look to and see what lung cancer really is today. It's not what I ever imagined. It's something that I am able to live with and manage and still have a very quality life with my family. And so now I really want every single newly diagnosed patient to see that, to see all the many faces of lung cancer. And we're fighting and we're living, and that's the most important thing. We're living one day at a time. And thank you so much, Dr. Gomez and Dr. O. We really appreciate all that you do. You'll never really know how much.
No, thank you.
Thank you again to our great panelists for a fantastic discussion. To learn more about the campaign, go to no1miss.org, where you'll find a lot of patient resources and downloadable materials. Thank you again. I hope you have a great afternoon.